Adolescent Bulimia Nervosa and Quality of Life by Amory Javier, Susanna Kim, Kayla Soriano, and Matthew Vega. This is Caden. Caden is a 16-year-old high school sophomore. She is a daughter to her mom and her dad, and a big sister to her twin brothers. Caden is a very good student. She has a lot of friends and plays for her high school's volleyball team. Her family and friends describe her as funny, smart, kind, and respectful. One day after volleyball practice, Caden was in the locker room with her teammates. As they were changing, some of her teammates were talking about their waist size and compared with each other. One of them saw Caden's jeans on a bench and noticed her waist size on the tag. Caden's size was larger in comparison to theirs. Her teammates bursted out laughing and teased Caden by asking her if she gained some weight. The rest of the team started laughing at her too. This made Caden feel very sad about herself. Eventually, some of the kids at school would joke about her size and would even go as far as comparing her to the weight of an elephant. Caden has been comparing herself to her friends and teammates every time she saw them. She felt insecure about her body and wanted to look skinny and pretty like them. Caden felt like everyone was judging her, so she set a weight goal for herself, but was too impatient to depend on diet and exercise.
Soon after, Caden was eating dinner with her family, and unknowingly she ate double her normal portion. She then started to think about how all the food she just ate would contribute to her weight gain. Immediately, Caden regretted eating dinner and was upset at herself for eating mindlessly. She then excused herself to the restroom, and for the first time she forced herself to vomit. Afterwards, Caden was relieved and realized that she had more control over her weight than she had thought. Though she felt guilty and ashamed, she quickly convinced herself that the feeling of relief and control was worth it. The next day at school, Caden ate lunch with her friends and excused herself to the restroom and discreetly threw up again. Though she felt guilty from throwing up her food, she enjoyed the ability to satisfy her cravings without gaining weight. Caden continued to binge and purge throughout the next few months. Her obsessive thoughts about her weight impaired her abilities to focus in school. Eventually, due to her poor grades, Caden got dropped out of her volleyball team. Caden was extremely embarrassed and avoided close contact with her family and friends. Even after realizing how obsessive she had become about her weight, she was unable to stop the behaviors that followed after eating. One day during lunch, Caden excused herself to go throw up in the restroom as usual. Out of suspicion, her friends followed her to the restroom behind her and caught her purging. Caden's friends were worried and decided to bring it to her coach's attention. Soon after, the coach invited Caden's parents over for a meeting and shared the information to them. Caden adopted an unhealthy eating habit that consisted of indulging large portions at one sitting and throwing it up right away to avoid feelings of regret and weight gain. This behavior is called bulimia nervosa. Bulimia is an eating disorder that is motivated by the desire to lose weight and involves binging and purging. Caden's obsessive thoughts about her weight and the stress to fit in with her friends disturbed her social life, academics, and hobbies.
With her parents extremely concerned with her new unhealthy habits, they sought out professional medical help. After discussing these issues with their primary care physician, they were recommended to an occupational therapist. Caden then met with the occupational therapist in the outpatient facility where they briefly discussed Caden's symptoms and experiences with their eating habits. After listening to Caden's story, the occupational therapist conducted an evaluation to determine the severity of her symptoms and how much they truly interfere with her occupational performance and roles. The occupational therapist used the Canadian Occupational Performance Measure to evaluate Caden. This evaluation is a holistic, client-centered assessment that focuses on the relationship between the participation in meaningful occupations and the overall health of a person. This assessment was done through an interview with Kaden to identify and rate her occupational performance in reference to her productivity, self-care, and leisure. Through this interview, the occupational therapist was able to create occupational performance goals and rate Kaden's satisfaction with her current level of occupational performance for each goal. The occupational therapist is using cognitive behavioral therapy as a frame of reference for a treatment plan. This will focus on teaching her strategies to help her cope and manage her symptoms of bulimia nervosa. Some of these strategies include life and psychological skill building through group therapy and family group therapy.
After the assessment using the Canadian Occupational Performance Measure, Kaden was provided a treatment plan by her occupational therapist. This treatment plan includes a 5-week therapy program that promotes social participation and helps individuals reintegrate back into society. The occupational therapist also incorporated family therapy into Kaden's individualized treatment plan. This ensures that there will be appropriate engagement from Kaden's support system to make sure that whatever they learn from therapy will be carried over at home. As a short-term goal, the client will establish and use 2 coping skills as a positive response to body dissatisfaction with minimal verbal cues 2 times out of the 3 trials for 10 minutes by the end of the 2nd week. Additionally, the client will engage in social participation and group therapy without disengaging independently 2 times of the 3 trials for 10 minutes by the end of the 3rd week. By anticipated discharge in 5 weeks, the client will participate in 2 social events using 1 to 2 coping skills independently 2 times a week for 45 minutes. After 5 weeks of treatment, Kaden is successfully able to overcome and manage her symptoms. She is now able to participate in all of her roles, such as being a student, an athlete, and a daughter. When faced with difficult situations, Kaden uses healthier coping strategies to manage her stress. After 5 weeks of treatment, Kaden has successfully reintegrated back into society, and her quality of life has significantly improved.